So what you're going to do, Anne, is I want you to lift one leg up as vertical as you can get it. Good. So Anne's actually got pretty good hamstring flexibility, so she can get her ankle right up to the ceiling. So most people with sciatic pain, when they lift their leg up, they're often quite tight in their hamstrings, and you might find they can only get up to about here, and with a very bent leg as well. So if you bend the leg so this is kind of what it would look like for a lot of people. It might start to trigger a sciatic response straight away. So because Anne's got good flexibility, it can show you where you want to actually get it. Now, what I see as well with this movement is, let's bring her other side up. And this is the side she tends to get her sciatic pain up. Now I want you to lift your leg up on this side. Good. Now, do you feel more restriction coming up on this side? She does. Yeah. So that is also quite a common issue, that the side they feel the sciatic pain will be tighter and more restricted, especially in terms of this exercise. The other thing that I noticed, and you might not be able to see with the black, but as she lifted her leg up, this other hip lifted up off that mat. Now we know that she's a little bit rotated and dropping down on the left side. So again, what we want to try to encourage is, as we lift the leg, we want to sink the opposite hip down. It will make sure that she's working more from a point of strength, and it should eventually make it easier for her to stabilize the pelvis and do this with less restriction. So when we look at Anne in this position now, what I'm going to get her to do is a pelvic tilt. So you're going to do a little lift of your tailbone, imprinting your lower back, and then send the tailbone back down. And again, pelvic tilt, and back down. And you'll notice as Anne continues to do this movement, that when she places her tailbone down, the ribs kind of pop up a little bit. So when you place your tailbone down, Anne, I want you to hold that tailbone down in a neutral position all the way, and take a deep breath in. When you breathe out, try to sink your rib cage flat onto the floor. Now push your tailbone down more. So that will feel like quite an effort for Anne to maintain. We're aiming to try to keep this rib cage down as well as the tailbone down. So if there's a lot of restriction in the middle back, you'll find that she struggles to maintain both those two structures on the floor. So again, that's another way to assess how tight the pelvis is, how tight the rib cage is, and that will all have an effect on that sciatic nerve as well. Okay, so when we look at the pelvis, we want to kind of look at for several alignment points. I've got two little stickers, and we're going to start with this front of the pelvis. You've got two little bony outcrops over here, and I'm going to mark the first one so you can see where that hip is. Then we're going to mark the other one. Sometimes this can be really tender, and we're going to place the next sticker here. So if you can see, it might not be as clear, but what I can see is this bony outcrop sits a little bit lower than the other one over there. Then the next we're going to look at is the placement of the rib cage. Now, you kind of slide your hands down your rib to the very base of the rib. I'm going to place one right underneath where this one is, and I'm going to place another one where the other one is. So if you can see, this rib is sitting a lot higher than this one, as well as this hip. So there's already this misalignment that's going to wreak havoc on that SI joint and as a result on the sciatic nerve. The next thing we want to think about, because I know that Anne has a little bit of scoliosis, so I'm expecting this misalignment already. But what we want to think about is there a bit of a rotation as well in the pelvis? So what I tend to do is I kind of push the pelvis back and forth, side to side, just kind of seeing if one hip is sitting higher than the other. And actually, this hip over here is sitting higher up off the floor than the other one. So I'm going to make an extra marking to show that it's her right hip that's sitting a little bit higher than her left hip. So it's rotating to the left and it's hitching up on that left side. So if you imagine that the whole pelvis is twisting and starting to rotate, and it's going to cause a lot of compression on the sciatic nerve, let alone the rest of the middle back, the shoulders and the neck. But just focused on this initial assessment, I know that we need to restabilize the pelvis, restabilize the rib cage to get that better alignment to relieve some of the pressure of the sciatic nerve.